Hey everyone, giving some time for people to join. Hope everyone's day has been good. We're here on the East Coast, so ideally it'd be kind of end of the day for most of the docs. I think during the day, afternoon might be kind of tough with patient clinics. And then as folks are trickling in, just for a quick background, I'm Arthur. I take care of our cardio arm here at Heidi, both for the US and Canada. And happy to jump in here and give a little bit more time as folks kind of join the room. I'm joined by my colleague Mahul, who's in the same room as me right now, but he'll be kind of filtering through Q&A in the chat. Give it one more minute. But again, hopefully everyone's afternoon's been going okay. Here in New York, looks like overcast, some rain. And then I guess we can get started and just let the other folks kind of join in, filter in. But just as a quick round of intros, my name is Arthur again. I run our cardio arm here at Heidi, take care of our cardio folks here in the US and Canada. And so happy to kind of go dive deep into Heidi for cardio, look at some use cases, how we set up templates, and then also not even just the notes, but also what happens pre-charting, what happens post-notes, and go from there. I'll let Mahul intro himself as well.
Hey everyone, I'm Mehul. I lead a lot of our work with medical specialties across the US, but I'll just be hovering the comments in case anyone has any questions. So feel free to keep them coming and I'll be getting back to you throughout the session.
Amazing, amazing. And then just to help orient the group real quick, I'll share my screen here just to kind of touch on one sec, just to touch on basically what we're going to go through today. But one, we're going to take a look at syntax, basically how the language of Heidi is structured, what the templates even look like. Two, we're going to go over some really good cardio note examples that I've worked with a couple other cardio clinics in the US and Canada, and what I've seen works the best in terms of tailoring the template to really match cardio-specific nuances. Third, we're going to take a look at being able to create a template from other examples. So how do we really create that nuance given the syntax with my own personal notes? Fourth, we're going to take a look at pre-charting, what happens, before the visit, during the visit, and also post-visit, if there's any follow-up documentation. And then lastly, something a little bit more powerful, we'll talk a little bit about our context tab. So beyond kind of the vocal transcription that you have with the patient, what other info can you supplement? So whether it's copy pasted medical info, whether it's labs, diagnostics, maybe it's echo reports or thick referral letters, discharge summaries that you're getting from the hospital. How do we intake all that additional context and supplement the current visit? So get me one sec while I get my screen sharing going. Apologies here. It looks like screen sharing not allowed here. We'll let Mahol do some tech support while I'm figuring this out. And again, just to kind of echo what Mahol is saying, if there's any questions, throughout the whole process, feel free to just drop them in the chat and then we can answer live. Apologies here. So just getting back into the swing of things. What I'm sharing here is the first piece. What is the syntax of Heidi? How do we really instruct the template to really match, my specific cardio nuances? So Mehul's here sharing his screen, and this is his view of Heidi. And also for context, for the folks joining, we actually just got back from ACC, so likely we may have actually bumped into you guys or chatted with you among the additional cardio folks that we're working with. So here in Heidi, this is our website, Mehul showing, and Mehul, if you can jump into our template library, just to give the folks instruction about what the syntax is. So if you open up a specific cardio note that I'm working with a clinic on, this is kind of the overall syntax for what we're working on. The left-hand side, completely ignore that for now. On the right-hand side, this is the syntax. We use three pieces. One, we use plain text for the section headings. Two, we use square brackets for placeholders or content in the note. And then lastly, we use parentheses for instructions about what to do. And so three very, very simple building blocks. But on the left-hand side applied, this is what we can do with it using very basic English. So for example, this specific cardio clinic, they like to have this phrase at the very top. I had the pleasure of seeing brackets patient name today, brackets patient pronoun is a pleasant, brackets patient age rolled, etc. And in the transcript, as you're talking to the patient, you're going to be mentioning their name likely, you're going to be mentioning their age. That information will then just fill into kind of the brackets and those placeholders. So if you take a look at this note, this specific clinic, they like to have the cardiac history here, including very, very specific prior diagnoses, any heart failure, any arrhythmia, any blocks, anything like that. And as you kind of read through the language, it's not using, or it's using very basic English to get across all the nuance, all the cardio-specific nuance we want to capture. The other aspect as you're kind of reading through this doesn't follow a typical SOAP. And the thing about Heidi is our bread and butter is really being able to tailor kind of the note structure, the content, the style, the format, specific to you as the individual clinician, and tailor all of that to you as opposed to kind of force fitting into a SOAP. For example, maybe you want to have cardiac specific investigations, your echoes, your EKGs in a completely separate section, as opposed to mixed together with the objective section of a general SOAP. And then as folks are joining in, if there's any questions, again, feel free to just drop it in the chat. So that's kind of the syntax for how we're doing this, plus some examples with some cardio notes. So this is one note that I'm working with the clinic, right? So they're delineating each of these specific cardiac investigations, their echo, the EKG. If we click out of this and we look at cardio note 4, for example, we can see that the structure completely changes, right? So in the very beginning, they like to have the subjective in bold, reason for visit, past medical history. So it's very different than the prior note where we're seeing, I had the pleasure of seeing XYZ today for XYZ reason. But you can still tailor the same content to be very, very specific towards cardio, whether there's any nuclear stress tests being involved, whether there's any findings in the echo. And again, the structure doesn't necessarily have to force fit into a SOAP, but it's more so tailored to the notes that you want to write. Now, the third piece is really, okay, so this is now the syntax for what you're doing. How do I really make this tailored to myself? How do I create a note in Heidi and make sure that the output is what I want to, what I want it to look like? What you can do is if you go to your template library and you click the black create button at the top left, there are two ways you can do this. One, if you click the black template button, you can build your template from scratch using those three building blocks, right? So I had the pleasure of seeing brackets, patient name, and brackets, and kind of go on and so forth, whether it's investigations, history, A&P, follow-ups, etc. The other option, as I'm sure you guys are probably too busy to kind of play around with the template creation, is if you have an example note, an actual patient note, for example, or if you have kind of rough structures of a template that you may already have existing in your EMR, you can copy paste kind of, if you actually go back to the create template and you kind of copy paste, for example, this example note of a cardio patient into this AI box, you can prompt saying, create a template from this example note. And then Heidi will do its best to kind of create the structure that we just discussed using this real life example. And as we take a look, Heidi will then write live for you, using the square brackets, the parentheses, about something a little bit more nuanced. This will get you maybe 80, 90, 95% of the way there. And then the last 5, 10%, we'll just kind of a quick glance through to make sure things look appropriate. If there's anything that's missed or, certain brackets may be missing. So very, very simple ways to either create a note from scratch if you have the time, or you're a little bit more tech savvy, a little more tech forward. And the other approach is with an actual example note, you can then copy it, paste it into Heidi, and then we'll do our best to kind of create that abstraction about this is the note, this is the structure, this is what I want to see. Any questions here in the chat? Awesome. And then I guess, touching on the fourth piece. So here, the note itself, as we're all aware, is not in silo, right? You're gonna have your pre-charting, you're gonna have all the prep that happens prior to the actual visit. Maybe even as you're walking to the clinic room or the space, you're gonna be kind of dictating, hey, I'm seeing patient Arthur for XYZ reason. This is a quick synopsis of what's gonna happen. And then you have the actual encounter, the actual visit with the patient. And then even post, there might be follow-ups, there might be referral letters, there might be synthesis of any other sorts of information. So in short, the progress note itself doesn't sit in silo across the full kind of care continuum. But what does that really look like in Heidi? That's exactly kind of the workflow we're building here with our context tab and the other pieces in terms of how we're working with some of these clinics. So with our providers and our surgeons, we're seeing two ways Heidi's being used. One is before the consult, they may start transcribing, they may mention some information about what's going on, and they'll either pause it or stop the transcription and create the note there. Afterwards, they may resume it when they actually see the patient, add in more live transcription based off of what the patient is mentioning. And then lastly, after the patient leaves the room, maybe you as a cardiologist, you want to add in additional medical jargon that you wouldn't necessarily mention to the patient, but you still want to include in the note. And so that's kind of the time and place to supplement the note with anything else. As I was mentioning with some of our surgeons, they're obviously not going to have this conversation live with the patient. So what they do instead is actually they use Heidi more as a dictation transcribing tool. So they'll just pick up their phone or their laptop or their desktop and just mention, just had XYZ procedure on Arthur. Procedure went well, no complications, no significant blood loss, and kind of go through their typical procedure, post-procedure summary, and then use a template that's tailored to that procedure they prefer or that type of note style they prefer, and then it'll populate from that 2 to 3 minute kind of dictation. So a couple different ways to do that. And then I guess more so on the pre-charting piece, we're building out workflows beyond just the scribing component to also match what the physical workflows you'd see in a clinic would be. So for example, if you have assistants, admins that might be doing the pre-charting for you, or some of the session uploading or kind of the scheduling, they can go into your account as a separate, as part of our team plan. they can start sessions and they can kind of do that pre-charting for you, just like Mukul is doing right now. So they can either context, they can paste in vitals, or they can attach uploads with our new attachment upload feature. As Mehul is typing in some prior medical history. The other aspect is beyond kind of live transcription, maybe you guys are working in an area without a concrete Wi-Fi service or internet service. You can also record audio either on your phone or a device and later upload that audio into Heidi and kind of create the transcript and the note post. So we can kind of show that off here. If we go to the dropdown with start transcribing, we can find upload session audio, and then we just go through our files to upload what makes the most sense. So as we're uploading a 4-minute transcription of a cardio interaction, Heidi will then generate the note using the template that you've selected that's tailored to this specific patient. We'll give it a sec here. And then again, as you see, the note is quite tailored to, in this case, Mehul's preference. It doesn't follow necessarily a simple SOAP, but it has, these cardio-specific nuances in terms of the structure, the content you want to pull out, as well as any additional details in terms of formatting. And the main thing here is Heidi as a tool itself is very nuanced with across medical specialties, just based off of the syntax that I described, right? Using very basic English to say, I want this note to look like a cardiologist note. I want to include cardiac specific history, investigations, echoes, etc. But that doesn't necessarily limit Heidi to cardio only. You can use basic English to say, I'm now a urologist. Give me, very specific colonoscope findings. Give me very specific XYZ interpretations or findings on that front as well. So in this case, right, Mehul is uploading that file, transcribing, creating the tailored note afterwards. Any questions up to this point on kind of adding in content, the syntax, tailoring the note to cardio nuances, and also building your own example note? Lovely, lovely. So the other thing is here, you've done the pre-charting, maybe your system's kind of started the session, they've added in vitals, they've added in more info. You as the clinician, you've started the session and started talking to the patient with more patient-specific info of the current visit. Then the question is, how do I get this into my EMR? What if I have any downstream documents I want to make? What do I do after this note? How do I get this into something that's actionable for me? Step one is beyond the main progress note, if there's any downstream documents, so referral letters, education letters, work authorization. At the very bottom of Heidi, we have an Ask Heidi bar. And so you can create any infinite documentation. So in this case, Mehul is typing, write me a patient-friendly education letter and non-medical terminology specific to this visit. And live, you'll see the note generate with all the info relevant for this patient, using very, very basic English about what's going on. And the idea here is with this Ask Heidi bar, you can get very, very nuanced, creative in how you want to prompt, creative in what you want to say and kind of create. So whether you want it to be, for example, a formal medical authorization letter, whether you want it to be a basic patient summary, patient education letter, or if you want to refer to a specific physician and you have their address, their date, their information, you can include that here as well. Beyond that, though, I can imagine if you guys are seeing 20, 30 patients plus per day, you don't really have time to type this out 20, 30 times plus per day. If you have examples or templates of what that look like, you can also create that here in Heidi. And instead of typing it out, you'll click that black create button like Mehul has in the top right. You'll find the letter that's tailored out to you. and then you just save and use. So in this case, we've created a patient explainer letter that's a little bit more tailored, more click friendly, as opposed to needing to type out a couple words. So beyond the main progress note, any other downstream document we can create. The other piece is with the progress note, how do I get into my EMR? The majority of EMRs that we're working with tend to be web-based. There's a couple that are kind of on the outlier, but for the majority of web-based EMRs, we also have a Chrome extension where you can sectionally write back into the appropriate sections from Heidi. So for example, Heidi with the subjective, you want to print back into the subjective section of your web-based EMR. You just open up our Chrome extension and there'd be kind of a function for pulling it open. We'll share our screen back in a second, but beyond the sectional write back with our Chrome extension, we also have a one-click copy button. So for folks that have an EMR that's structured with a large text box, for example, like Epic, or other EMRs that have large text boxes, as opposed to section by section, that one-click copy works quite well in copying that format from Heidi and pasting it back into your EMR. And even for kind of these larger EMRs like Epic, we're rolling out our integration quite soon to be able to go back into, for example, Hyperspace and HiQ for both mobile and web. Give us a second as we're pulling up a more prescriptive example of the Chrome extension. And the other thing is, as some folks from ACC are joining, agnostic of our current and existing cardio users, for folks kind of joining this specific webinar, happy to do a month-long pilot, kind of trial it out for the folks from ACC that might be a little bit curious about AI scribing. But again, net, this is kind of a new field, especially in healthcare. And we all know how slow healthcare can be with, adopting very quick, very innovative tools. So just kind of give some instruction about Heidi, share what AI scribing can do overall, and then what we can specifically do in the realm of cardiology. And then post this, I'll share my email, and if anyone is interested in kind of rolling out a longer pilot for the clinic, feel free to let me know. So what Mehul is sharing here is an example web-based EMR called Clinico. And then we're pulling up an example note in our Chrome extension. So our Chrome extension here is on the right-hand side as an overlay. And then on the left-hand side is Clinico and all these different text boxes. You can imagine each of these text boxes as something you'd see in your EMR like Athena or others. And as Mehul opens up the Chrome extension, you'll see there's a little Heidi icon that pops up in the top right of each box. And then as you kind of filter through which session, which patient you want to write back, what you can do is you can click that Chrome extension, and then it'll pull up kind of sections of the note specific to that example. So in this case, Mehul's pulled up an example urology patient. It follows assessment plan HPI. And as he clicks the extension, you can see that he can write back, for example, the past medical history into the past medical history section, the assessment section back into the assessment section. So for the majority of web-based EMRs, this works quite well if our direct integration isn't available yet. So that gives some context about what's possible in the broad scale of patient intake, from pre-charting, getting some more info in, whether it's from referral letters, discharge summaries, anything like that, plus the actual visit with the patient, and then post-visit, if there's any downstream documents, and also kind of getting that information back into your EMR. The other piece is specifically on kind of the pre-charting. We recently launched our attachment upload feature. So if you guys have examples of lengthy reports coming from, again, these discharge summaries or referral letters, whether you guys have reports from prior echoes, prior EKGs, although we're not able to take in the specific graph or the raw graph of an echo or EKG, if there is kind of text-based summary or kind of findings shared by another cardiologist, we can intake all the information from our attachment upload and kind of synthesize all that information and enrich the current note for that specific patient. The other aspect for the upload is we're actually building more robustness to also capture handwritten and examples of faxes and scans that aren't easily text recognizable. So most recently, we've launched a more powerful version of this to take in large quantities of faxes and scans. And then even more in the short term, we're going to build a little more robustness that kind of also capture examples where maybe it's a scanned in document with text plus some chicken scratch from the referring provider or some handwritten information. And then the last piece I want to touch on here is beyond the syntax of Heidi, beyond kind of examples of how you can tweak this for cardiology and use very creative prompting to match your specific style, as well as just uploading examples of your own note into Heidi to create that nuance. And then lastly, going from pre-chart to the note itself to post. The last thing I wanted to touch on is a bit more of our context tab, which just gives more flavor and more color to the patient itself. As we all know, patient comes in, they're not going to be siloed. There's going to be additional information that comes with them. So whether it's that prior attachments, uploads I was mentioning, whether it's copy pasted history from your EMR, or even during the visit, let's say during the visit, I'm noticing, okay, this specific patient, he or she is shivering a little bit. They look a little bit pale. Um, I notice they're just not very attentive. They're not really paying attention. But I don't want to verbalize this to the patient. I still want to include in my notes. I think it's important, but I don't want to kind of offset anything that's going on. What I can do instead is I can type into context. I can go back to the note and then I can press this black sync changes button. And so that'll take in all the information in context that's recently added, plus the transcribed information, and then create a more enriched note with all that info. And then as Mehul is showing, the note is a little bit more enriched with kind of the nuances about shivering, about not really paying attention. And then the last piece I wanted to open up here is this isn't the end all be all, right? So this notice here, but any minor edits you can also directly add in either directly or you can also resume the session and add in more information. So let's say, again, you saw the patient for a little bit, patient's left the room. If there's any specific medical information you want to add in, you can always resume and kind of enrich the transcription that way as well. So I'll open up the floor for kind of general Q&A. If there's any questions on those pieces I touched on, right? So the syntax of Heidi, creating something more cardio specific examples, as well as how do I do it for myself? And then what happens pre and post? If there's any questions on those pieces, or even, your own specific templates, for example, how do I get this to include my echo? How do I get this to split out my left ventricle ejection fraction? How do I get this to split out left versus right? How do I get it split out into this specific format? Just drop all questions in the chat if curious. The other aspect here is if there's any general workflow questions, so not necessarily just specific to cardiology, but as I'm moving room from room, how do I make sure information is kind of shared appropriately, and how do I go from my phone back to my desktop, back to my laptop or something along those lines? There's lots of ways Heidi can be used throughout the day. And just for context, a little bit more background about Heidi. We were actually founded by a vascular surgeon, and so it kind of comes from that clinician end, where the intention of Heidi is meant to be tailoring across workflows. So whether or not, some providers may be using their phone for the majority of cases, whether they're using a laptop or a desktop, the intention is to kind of go across the full workflow and kind of embed and really simplify note-taking in that sense. But if there aren't any questions, we can definitely give some time back. I think of the past 20, 30 minutes where I've just been kind of speaking to myself in this case, the main takeaway here is there's a lot you can do with Heidi in terms of tailoring out something that's more cardio specific. And all it really takes is kind of prompting and kind of working with Heidi to kind of look for those specific workflows that match towards what you're looking at. And I see you and Lam is raising your hand. Any specific question? I guess I'll just unmute and then let me know live.
Oh, hi. I put out the question. I was like trying to type it out. So I missed a part of your presentation, and you mentioned that in the context, anything that I wanted to add, prior discharge summary, last echo, any prior testing, let's say if I was pre-charting, I can put it into the context, and then it would incorporate that into the actual note when the patient's there. Is that right?
Yep, exactly. So
Okay.
if Mehul kind of goes back to the context tab, so let's say you have those documents in, and you can just attach it in the bottom left with that attachment
Mm-hmm.
icon. The other aspect is if you have kind of the actual verbiage, you can copy paste it in. Or the
Mm-hmm.
third option is ignoring context. You can also just kind of dictate to Heidi saying, I just got back the echo from XYZ referring provider. This is their summary. You can pause it,
Mm-hmm.
and then you can then add in more information live with the patient too.
Okay, gotcha.
Yeah.
All right. So, and then in terms of like the assessment and plan, if I wanted it to have a little bit more elaboration in terms of like the thought process, that just tweaking the template and asking Heidi to expand that, or do you have any specific recommendations?
Yeah, it's really the template prompting. So what I've seen with some of the more general, for example, impression and plans, where it just says
Mm-hmm.
it's the diagnoses, the clinical impressions, any, likely versus differentials. I
Mm-hmm.
personally also like to add at the end, include clinical rationale and logic that supplements or supports this the diagnoses. So that'll help
Mm-hmm.
from the patient's objective, their history, any objective findings, including any investigations that you might have.
Mm-hmm.
And then whether or not you want to create it in a list form as opposed to kind of a narrative discussion, you can also prompt it to say, full clinical logic in a paragraph that supports a diagnosis. Make sure to pull from any relevant history, objectives, tests, diagnostics, etc. Just so, for example, if
Mm-hmm.
you're looking for prior auth or something like that, there's just more robustness in the evidence.
Okay, that's helpful. I used it today, and one of your team members had helped me change the template, and it definitely was improved, but the assessment plan wasn't quite where I needed it to be. So I will add you said specifically it's like add logic for and supporting information for diagnosis. Is that what I'm supposed to
Yeah,
prompt it?
exactly. I would say add clinical logic, just so.
Add clinical logic. Okay. All right, I will try that for next time then.
Lovely, lovely. Any other questions from the group? Awesome. And then if none, again, for the folks kind of joining post ACC that we've met or kind of briefly touched on, we are happy to do kind of a month-long pilot for you guys just as a way to kind of give back to the community and also really get a better feel for the product and Heidi in your workflows. My email is arthur@heidihealth.com. And so feel free to just reach out and we can set up some time and talk further. Otherwise, if it's more so just template help, Heidi help, general questions, feel free to shoot them my way post-webinar as well. But anyway, it was lovely to chat and thank you again for the time. Definitely know you guys have very, very busy schedules. So we'll touch base at some point soon. Take care, everyone.
Thank you, everyone.